That one was hard. Good afternoon and welcome to the Committee on Commerce and Labor. Committee Secretary, will you please take roll?
Assemblymember Anderson. Carter. Cole. Hardy. Howdigi. Kasama. Miller. Monroe Moreno. O'Neill. Roth. Torres Fawcett. Yeager. Urick. And Chair Marzola.
And I am here. Please mark members present as they arrive. Welcome everyone that is here with us in Carson City today, those tuning in Las Vegas, and those also listening over the internet. Today we will hear three bills: Assembly Bill 143, Assembly Bill 318, and Assembly Bill 334. We also do have a BDR introduction. Before we get started, I would like to make a few housekeeping announcements. Members of the public may provide testimony in various ways, all of which are listed on the agenda. When testifying, please remember to turn on your microphone to speak and off to listen. Also remember to state and spell your name for the record. If you have handouts for the committee, please provide 20 copies to the committee secretary prior to your testimony. Committee information is available on the legislature's website. You may also watch our meetings through the legislature's YouTube channel. We ask that public comments be kept to 2 minutes so that everyone can be accommodated. As always, I expect courtesy and respect in all our interactions, even if we may not agree. Please remember to also silence all of your electronic devices, especially your cell phones. We will not be taking the bills in order today, but we are going to start with our BDR introduction. Next, we will introduce BDR number 57696. This measure is sponsored by the Committee on Commerce and Labor, and it revises provisions relating to motor clubs. Please remember that a vote in favor of introducing a BDR does not imply a commitment to support the measure later. All this action does is allow the BDR to become a bill and enter the legislative hearing process. It does not apply commitment to support final passage. And with that, I will entertain a motion to introduce BDR number 57696. I have a first from Assembly Member Natha Anderson and a second from Assembly Member Monroe Moreno. Any discussion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Motion carries. And with that, we will move to our first bill hearing, which will be Assembly Bill 334. I will now open the hearing on Assembly Bill 334. This measure revises provisions relating to oral health. Before we get started, I do want to let everyone know that I am limiting testimony today. We will do 30 minutes for support, 30 minutes for opposition, and 30 minutes for neutral, which means 10 minutes here in Carson City, 10 minutes in Las Vegas, and 10 minutes over the phone lines. And with that, Assembly Member, you may get started when you're ready.
Thank you, Chair Marzola and members of the committee. I am Heidi Kasama, representing Assembly District 2 in the beautiful Summerlin area in Las Vegas, and proud to be here and serving in our legislature. Assembly Bill 334 revises provisions relating to oral health. As some background information, as you may know, the nation here has a severe shortage of dental hygienists, as we do in many other health fields as well. The American Dental Association reported in late 2024 that between 30 to 40% of dentists had recruited dental hygienists. Among dentists who reported they were actively recruiting, 90% of dentists call that process very much extremely challenging for them to be recruiting. Many of you may be aware that Nevada is also facing a critical shortage of dental hygienists. Recently, there have been several news stories of patients waiting for routine cleanings months beyond when they are due. Assembly Bill 334 seeks to address this issue and improve access to dental care for all Nevadans. What does this bill do? One, it streamlines the application process for dental hygienists from other states. Two, it provides for expanded functions for EFTAs, the expanded function dental assistants that was created in the 82nd session. I'd like to just go briefly through sections of the bill. Sections 1 and 2 of the bill prohibit the Board of Dental Examiners of Nevada from adopting regulations requiring an applicant for licensure by endorsement to practice dental hygiene to have practiced dental hygiene in another state for a specified period of time immediately preceding submitting an application for such a license. This allows applicants to practice in Nevada without unnecessary burdens or delays. Section 3 of the bill authorizes an expanded function dental assistant or dental hygienist with a special endorsement to use an ultrasonic scaling unit and perform coronal scaling. These providers are already trained to clean dental cements and bonding from teeth. By allowing them to also clean plaque, we can increase access to basic dental care and allow hygienists and dentists to concentrate on more intricate, complex cases. With that, I'd like to introduce other members at the table here with me. We have Paul Klein with Tri-Strategies, and we have Dr. Whitney Bryant of the Nevada Dental Association, and I'm missing one introduction.
I am Dr. Amy Abatian of the Nevada Dental Association.
Wonderful. Okay, so with that, I'll turn it over to Mr. Klein.
Paul Klein, K-L-E-I-N. Thank you, committee members and Chair Marzola, for hearing this bill. Thank you, Assemblymember Kasama, for pursuing this bill. Through the introduction, Assemblymember Kasama explained the legislative intent of this bill. In the most basic terms, this thing asks of you two things. One, to allow the immediate licensure of dental hygienists who are eligible to practice. And two, adding coronal scaling to the expanded function dental assistant role. Now, what this bill ultimately is about resourcefulness. And I believe in Nevada that whenever there's a problem, we're not one state to ignore the problem or expect a solution to just arrive. We're gritty, we're innovative, we're creative, and we're resourceful when it comes to a problem. So here's the problem. All 17 Nevada counties are designated as health professional shortage areas. 66 of those areas are considered dental care health shortage areas. 71% of Nevadans are without adequate dental care. Wait times for basic routine cleanings are maxed out. Now, this is specifically because we have a critical hygiene shortage. We do have two fantastic hygiene programs in Nevada, but those programs can only graduate about 40 people annually, not nearly enough to meet the demand that we have here in Nevada. So here is the Nevada data, our current state of this workforce. We have approximately 1,500 licensed hygienists in Nevada. So that works out to be one hygienist per 2,200 Nevadans, or 45 hygienists per 100,000 residents. And so just to compare that, the national baseline, the average, is 64 hygienists per 100,000 residents. Again, we're at 45. And it must also be noted that of those 1,500 licensed hygienists, they pay their fees every 2 years. So in those 2 years, perhaps some of them left the workforce, some of them became dentists, and some of them work part-time. So that ratio of 45 to 100,000 might be even more dire than we think it is. So this is why we've really looked at the first part of the bill, which allows the immediate licensure of eligible hygienists in other states. However, we also need to look at the national pool of workforce that we can attract from other states to come in Nevada. So this is a national poll done by the Health Policy Institute, and what they found is that 10% of the hygiene workforce left after the pandemic. A third of those hygienists are retiring within the next 3 years. It's a massive amount of workforce that's going to be gone. 50% of hygienist positions are vacant in 20 of the largest 20 U.S. cities. And 40% of practices are struggling to recruit hygienists. The point is that even our issue here in Nevada, it's not unique to Nevada. Everybody across the country is in need of hygiene. Everybody. And so we have to essentially rely on the attractiveness of Nevada for folks to move here, live, work, and play. But that workforce simply does not exist out there. So let's look at the pipeline. There's 350 approximately hygiene schools across the nation. Graduation rates for the last 10 years, that's the orange line dotted across the top, are stagnant and decreasing. So we're graduating about 7,000 hygienists a year. It's not nearly enough to meet the demand, nor is it enough to just simply refill the workforce that is retiring. So in all, there's not enough hygienists available nationally, and the pipeline is not growing to meet the demand. This is when I talk about resourcefulness. We can make it attractive for folks to move here and work easily through reciprocity that we talked about in part 1 of the bill, but also we have to be resourceful and smart to try and find opportunities to solve this gap. And so the answer, we believe, is yes, make it easier for hygienists to come across state lines and work in Nevada. But 2, utilize our expanded function dental assistants to help with basic routine teeth cleaning. The expanded function dental assistant is a level above the dental assistant and works alongside the hygienist and the dentist. This isn't new, by the way. Several states employ EFTAs to do scaling, teeth cleaning, and the U.S. military has allowed this for years, and it works. Care is better served. Just real quick, coronal scaling, that's the legislative language, is using a tool to remove plaque from the visible part of the teeth. It's as simple as that. It's scraping that plaque off the teeth. Now, what's used mostly to do this work is this tool right here, and they're all different kinds. This is called an ultrasonic scaling unit. When we talk about resourcefulness, these EFTAs can use this tool right now. They're authorized by you all in the last session to use this tool. They're trained and using this tool to remove dental cement or bonding agents from the visible part of the tooth. So an example would be when you get your braces off, that cement, that glue underneath the bracket, they're using this tool right now to scrape that off your tooth. We're simply saying, let's let them use it to remove plaque, a much less dense material. Or this old school tool, we're all familiar with these. This is another scaler. A lot of these, we have these at home. You can get these at Walmart for $8.99. But essentially, that's what we're asking here, is to use our resources that are capable, trained, to use this tool to simply also remove plaque. And we believe that is an answer to our hygiene routine cleaning shortage. I'll now pass to Dr. Whitney Bryant.
Thank you, Paul. My name is Dr. Whitney Bryant. I graduated from TMCC's dental assisting program in 2010, went on to graduate from dental school at UCSF in 2018. I'm currently a community health dentist. I work in the rural areas providing a school-based sealant program and other services to at-risk youth and some of the communities that aren't even privileged to have a dentist, let alone a hygienist. So this is my reality. These pictures show at the bottom of the red arrow areas where there is plaque buildup. And you will see on the other side there is a dark missing area of tooth structure. So that plaque buildup over time is acidic and dissolves away tooth structure. Children are not getting proper access to care, and damage is irreversible. I rely heavily on my assistants in maximizing the difference that we can make. When we go to these rural communities, we are there for a matter of hours. The supervision for expanded functions dental assistant requires me to be on premise, watching and checking their every move, but it does allow me to have 2 people who have an extra set of skills to help me treat these students. Next, please, Paul. Do you know every day you are responsible for removing your plaque from your teeth? We teach everyone to brush their teeth. You're you're responsible for learning to brush and floss and remove plaque so it does not turn into calculus. But once it becomes calculus, now we have to rely on the dental professionals. And we just want to train all of our dental professionals to help us remove that plaque and calculus. If you walk down the street and you see a piece of litter, your temptation is to pick it up and put it in the trash. When we see debris inside the mouth, all the oral health medical or dental professionals in our office feel the same way. We want to be able to help take care of our patients, keep everything clean and healthy. So let us educate and train more licensed professionals to help our patients. So the licensed dichotomy of dentistry in our current dental practices, there's only 2 licensed professionals. The dentists, and there are 3,500 in Nevada, and the hygienists, there are 1,500 in Nevada. You typically hope to see your dentist at least once a year for an annual exam and then as needed, but you expect to see your hygienist at least twice a year. Twice a year is for healthy gums. If you have diseased gums, you want to see them 3 to 4 times. The math says that we should have more hygienists per dentist. Most of my colleagues will insist that we would like to have 2 if we could, but there's a big bottleneck. So our patients are not getting seen and the disease is getting out of control on our watch. We tell them they need 3 to 4 cleanings a year, but then we can't provide that for them. The expanded functions dental professional is another licensed professional. They're trained, qualified, accredited. They go to a code-accredited program, similar to all dental school or hygiene school. They will be required to pass a jurisprudence exam and a licensed clinical exam. And then also, even if we were to create an expanded functions dental assistant out of every regular dental assistant, there's only 1,700 in the entire state, so it still would not fix our dental hygiene shortage. So what is that? We are asking for reciprocity, obviously, for the hygienists to be able to come into the state if they so choose and make it very easy, but they would still have to choose to do so. And in my case, many of them are not choosing to move to our smaller communities like Lovelock or Winnemucca or Yerington, Nevada. So what is the task I'm asking for help? We are asking to help remove plaque, stain, and calculus from above the gum line with the intent to be overseen and completed by a dentist or a hygienist. So all that fuzzy stuff, I would like that to be gone before I get into the chair so that I can focus on the stuff that's underneath the gums. The top layer of things that you're seeing in those areas, it's causing gum disease early signs, and that's a child. So we're adding a skill for the expanded dental assistants. We're not replacing a skill set. So somebody still needs to get in there in the inflamed areas and do a better job. So cavities starting from plaque accumulation above the gum line, that really opaque white layer used to be covered by that sticky plaque, but it was left there for too long. If you leave that stuff there for too long, it creates irreparable, it's not irreparable, but it does not self-heal. So it is replaceable. We could put a filling there, but it will not heal on its own. We still need our hygienist to help us focus on treating active disease. So you can see that this advanced form is seems a lot more serious because it is. These type of adult patients, this would still be a case that would be strictly reserved for our dentist and our hygienists. There's bone loss and damage below the gum line, but this also had to start somewhere. We want to be preventative and we want to be able to use our assistants to help us prevent this situation instead of waiting until it's this bad and then insisting that patients need to be seen 3 and 4 times a year. So the question becomes, what is the education and the requirements if we're going to allow them to do these advanced procedures? I noted in yellow the areas where they are different. So it's an 18-month program opposed to a 24-month program, 24 months of work experience. For the dental hygienists, they usually have prerequisites or that they're specific to the program, so it's unknown. They both have boards, clinical exams, and laws and regulations. They must be certified CPR, and our expanded functions dental assisting program is set to have 125 hours versus of lab time, and the current TMCC program would have 125 credits versus CSN for hygiene is only 88 credits. So it would require more credits than the dental hygiene program at CSN. So public health issues that are arising from our current model is hygienists are in high demand, and they want to live in areas that maybe aren't so rural. So rural communities are finding themselves learning to work without them out of necessity. Just because I don't have a dental hygienist does not mean that I'm not going to clean my patient's teeth. Existing dentists are doing cleanings, and we are hiring new graduates to come do cleanings for us. So it's less time to treat patients on emergencies, and it puts us in tough treatment situations when we would like a clean slate to do dental treatment, but we have not had the time to get our patient into our cleaning schedule. Adult patients are not getting cleanings and their disease is getting neglected. If you need 3 cleanings a year and we're only giving you 1, then guess what? It's not helping you, and it's not helping your disease. So child patients deserve to have licensed professional cleanings to prevent gum disease. So I focus on prevention, I prevent cavities, I teach good dietary habits, and this is just allowing us to add another licensed professional to help prevent problems. So my message is oral health is health. I know that we often think about dental insurance and health insurance as 2 separate things, but our mouth is the gateway to our entire body. So let us train more individuals to help keep our patients healthy. Let the assistants create a career path, increase their skill set, allow them to help the patients that they love, help us get higher quality of care for our patients, and especially our kids, help our rural communities get access to care. If they have an assistant but not a hygienist, this is an opportunity for them to really make a bigger difference. And we need to keep our teeth clean in all aspects of dentistry. So allowing the assistant to help clean the teeth, I think, is really going to be beneficial and support the dental office, hygienist, dentist, patient, everyone involved. So please support AB 334. Thank you.
I don't have a presentation, but I'll answer any questions that are asked.
So with that, Assemblywoman Heidi Kasama, with that, Chair, we stand ready for questions.
Thank you, Assemblymember, for your presentation today. Committee members, are there any questions? I don't see any. So I do have a couple of questions. On one of the slides, you stated that several states had passed legislation such as this. Can you tell me how many states?
Paul Klein. So the state of Kansas has actually had this in law since 1998. And I actually have just a piece on that. I'll just take a moment on this.
Yeah,
so Kansas has allowed this since 1998, and they do a 10-year audit of how's it working. And just so you know, the feedback is 2/3 of dentists are serving patients better. 70% of these dental scaling assistants, that's what they call them there, went to underserved areas, and no hygienist jobs were taken, but rather supported. So the state of Kansas, state of Illinois, Missouri has what they call an OPA, Oral Preventative Health Associate, and the U.S. military. And Arizona is seeking, they just passed it out of their Senate yesterday.
So 3 states have passed.
3 states.
Thank you.
I guess I'll add that there are certain programs where training on the job type of stuff. So they're not essentially EFTAs doing this work, which is a more advanced level that we're seeking. But there are states like Alabama and others that allow dental assistants to learn how to scale on the job towards a hygiene credential.
Thank you for that answer. My last question is, and I may be a little confused, so the dental hygienists or the dental assistants now will need additional training, correct? So they'll have to go back to school and incur those costs?
Dr. Amy Abitian, for the record, Chair Marzola. These would be assistants who are extremely interested in the field, who wish to go further. These are our most dedicated assistants who wish to have expanded training in the field, to be able to do more, to serve more, and to have a viable career long term. Thank you. So this wouldn't be all assistants that would have to go back to school for this. Our dental assistant training and requirements would remain as they are. This is simply another avenue for these dental assistants to pursue and be licensed as expanded function dental assistants.
Thank you for that answer. Committee members, are there any additional questions? Assemblymember O'Neill.
Thank you, Chair. So, as I understand it, a dental assistant now is trained by a dentist to work in that office, correct? There is no other licensing for them?
Dr. Amy Abitian for the record, Chair Marzola, Assemblymember O'Neill.
You can go direct.
Okay, thank you. Currently, assistants can be trained in a couple of different ways. So it exists that we can hire assistants into the profession and do solely on-the-job training. Or we can have assistants who go through the Registered Dental Assisting Program. We have one at TMCC, and it is quite rigorous training. But we have the flexibility in this state to do both ways.
May I follow up, Chair? So, you did a beautiful presentation, I will admit. Maybe I'm just confused. So the dental assistant is trained. There's no licensing. They graduate from TMCC or they graduate from your office. And now they have to go back to an approved school and get licensed by a national board, but they can come to Nevada without any other requirements, no background check on them. I'm just asking, I guess I'm looking more towards the licensing function. Is it totally unregulated, or what are the regulations?
Okay, so Dr. Bryant, for the record, what I would like to speak to is that currently the dental assistant is an extension of the dentist's license. Anything they do, I am responsible for that. Adding a license to the dental assisting profession will create another safety barrier because they will now be subject to the laws and regulations per their license. So when another assistant comes from another state, there is an option to have a national dental assistant license, but our state does not have a specific one. Certain states like California require multiple, so they have a registered dental assistant, expanded functions 1, expanded functions 2, tiers of licensing. Our state was just set up to not have a current regulating body for dental assistants. So we would be adding that regulating body.
Chair, if I may, just to make sure I understand this clearly. So the expanded dental or the dental assistant, the EFTA, all the liability sits with the dentist if something goes amiss, correct? And not with the EFTA.
So once you have your expanded functions dental assisting license, there will be things that you will be ethically obligated, and you will be responsible for your actions. But always, when you have a direct supervision, even the dental hygienist, a lot of things that are performed in my office are ultimately under my liability and my license and my responsibility. When we are adding this expanded functions dental assistant from a state like ours, there's a 2-year requirement of being an on-the-job trained. You must pass the national boards and then go to expanded function, or you could do a TMCC formal CODA accredited program, pass the national boards, and do the expanded dental assisting program. So there are clear pathways from the on-the-job version and the registered version or educated version without. But once you have that license, those individuals will ultimately be required to uphold that license, but the liability is always on the dentist, especially for supervised positions like an assistant of all kinds.
If you can remember to say your name.
Oh, yes, Dr. Bryant. I apologize.
I appreciate that, and I've got some more questions, and I'm sure Mr. Klein would be more than willing to stop by my office in the near future. Thank you. Thank you, Chair.
Assemblymember Cole.
Hi. Thank you very much, Chair. My question is on the insurance side of things. So you have potentially two different people who are providing services. You've got the coronal scaling, and then the hygienist or the dentist comes back and then does some extra work. Is that two separate insurable instances, or is it just one cleaning?
Assemblymember Cole, Dr. Amy Abatian for the record. No, that is not two separate instances. The expanded functions dental assistant is a force multiplier, if you will. I'm also part of the National Guard. We are a force multiplier, so we are not intended to replace anybody's job. But when there is a need for gaps in coverage in any of the industries that we help serve, that is there to help us. So this is another assistant who will still have to have their work checked by a dentist, checked by a hygienist. So it will still bill to insurance the same way that we have traditionally always done that. This is just another set of hands to help facilitate the treatment more effectively, more efficiently.
Members, any additional questions? I don't see any. So we will move to testimony in support. Please remember, we will have 30 minutes of testimony in support. 10 minutes here in Carson City, 10 minutes in Las Vegas, and 10 minutes on the phone. Is there anyone here in Carson City that wishes to testify in support? Please remember to state and spell your name for the record. You have 2 minutes each. You may begin when you're ready.
Good morning, Chair Marzola and members of the committee. For the record, my name is Taylor Avery, and I'm the Manager of Political Affairs for the Vegas Chamber. The Chamber is in support of AB 334. The organization agrees with the premise that the board should not adopt regulations that hinder an applicant's ability to be licensed in Nevada if they have practiced in another state. The Chamber believes that boards should foster paths to licensing for healthcare professionals because of the existing dental professional shortage Nevada is facing. We'd like to thank the bill sponsor for bringing the bill forward, and thank you for your consideration.
Good morning, Madam Chair. My name's Egan Walker. I'm a district judge in Washoe County. I assure you I'm here as a judge and an individual. I laugh because I think I can spell dentist. I'm pretty sure I can't spell hygienist. But I'm a boots on the ground guy, and my message to all of you is by way of information. I've had the privilege as a judge of being responsible for foster care children, for juvenile justice children involved in the juvenile justice system, for minor guardianships and adult guardianships. And I'll tell you every week as a judge, this is not an exaggeration, every week as a judge, I'm faced with this prototypical example. Mom, dad, grandma, grandpa responsible for a young adult, a child, or an aged adult who has special needs. And I have citizens that I see each week who can't get dental care, preventative dental care. And so that acidic plaque that the doctor was talking about that leads to dental caries and tooth loss, I have people I see every week whose teeth are literally rotting out of their head, and I can't get care for them in the foster care system, in the juvenile justice system, in the minor guardianship justice system, or the adult guardianship justice system. So I'm here as a citizen on my own, a person who receives dental care, thankfully, but I beg of you, access to dental care as a judge, ironically enough. Thank you for your time.
Good morning, Madam Chair and committee members. For the record, my name is Mariana Kacyra, M-A-R-I-A-N-N-A-K-A-C-Y-R-A. I am the Executive Director of Nevada Dental Association. One of the biggest challenges facing Nevada's dental community today is critical shortage of dental hygienists. Across the state, our members consistently tell us the same thing. They cannot find hygienists to hire. This isn't just a workforce issue, it's a public health crisis. Hygienists play a vital role in preventive care, and without enough of them, patients are waiting longer for appointments. Access to care, especially in rural areas, is declining. And more Nevadans are at risk of serious dental issues. When preventive care is delayed, we see more emergency room visits, higher healthcare costs, and declining overall health. To help address this shortage, the expanded function dental assistant bill is a critical step forward. By allowing trained FDAs to take on additional responsibilities like chronal scaling under dentist supervision, we can improve efficiency, reduce patient wait times, and expand access to care. This bill doesn't replace hygienists. It supports the entire dental team and helps bridge the gap while we work on long-term solutions. Nevadans deserve timely and quality dental care, and we need policies that support that goal. So my ask is for all of you, please help us to fix the problem with public health crisis and support the FDA bill to alleviate this crisis. Thank you, everyone.
Thank you. Once you're done with your testimony, if you can please get up to let others join. Thank you.
Dr. Deborah Peterson from Reno. So again, my name is Dr. Deborah Peterson, and I'm on the board of the Northern Nevada Dental Society, a delegate to the Nevada Dental Association, and a CE chair for the NDS. I've been a general dentist for 9 years, and I've been practicing in the state of Nevada for 5. I was 50 years old when I graduated with my degree. Speaking before you all today is the prime reason I went back to school. Having come from over 30 years of management experience and spending close to $500,000 on my degree, I am here to affect change. I'm here to affect change within my profession and within my community. I became a dentist because I worked in the landscaping arboricultural business, and I saw firsthand how the lack of access to care affected my workers, my migrant workers. Our government and regulatory agencies do not make it easy, and large swaths of our population to get care, all in the name of patient protection. I was surprised and somewhat offended that our own professional societies are battling about this issue right now to try to get access to care to these people. Nevada needs more mid-level providers. As the state grows, the talent pool is not keeping up. License portability and expanded function assistance will go far in filling this need. The dentists of Nevada support a well-trained, expanded function workforce to service our patients. All we are asking is to allow additional training for expanded function assistants to use ultrasonic tools for supragingival calculus. The ultrasonic cleaner is simply another tool in our arsenal to combat disease, nothing more. It scares people, but it's just a tool. To use some landscaping lingo, I'm going to say that these turf roars between the dentists and the hygienists need to end.
If you can please wrap up your testimony, your time's almost up.
Okay, and I'm here to say that if I can teach a big burly guy how to use a chainsaw without hurting himself, our societies can come together and teach people how to scale teeth without hurting people. Thank you.
Hi, Dr. Jason Doucette. I'm a practicing dentist of 26 years in Reno, Nevada, former president of the Nevada Dental Association. I think that this is a monumental step in the right direction to solve this problem that our profession has been dealing with for almost a decade now. This is even pre-COVID. We've had issues with getting enough hygienists to treat our patients and give the population access to care. So you've heard enough about what this all means, but if you think about it, you know, if an EFTA trained, a highly trained assistant can easily put a piece of floss through the contacts on either side of a cap or crown that's been cemented by a dentist to loosen the cement that is set up and pull it through, I think they can easily be trained to remove tartar or calculus above the gum line around the tooth as well that has the same urge, is just as tenacious. So I think, again, just a great step in the right direction to solve this big problem we've been dealing with for a number of years. Thank you.
Good morning, community assembly members. My name is Michael Novick, and I am an assistant for an orthodontic practice in Reno. I'm just here to go ahead and support this as an assistant in an orthodontic practice. I will say that I did first do the program through TMCC to become an assistant, and as my job, I can actually use a handpiece to remove glue from teeth to help and assist with the doctors to keep everything on schedule. I think something that's really important is to be able to be allowed to further my education in what I do. I'm I really like what I do, and I think that due to the fact that there is so many hygienists here that in the area that there's so many patients to hygienists, it's really hard for the community to get in to see a hygienist or to have teeth cleaned. I think that this is only here to really help the hygienist perform their job. I don't think in any way that it is here. I don't want to be a hygienist. I've never wanted to be a hygienist. And I don't want to take that away from them in any way. I think that they're very qualified in what they do. I just think that to be there to help them, I think can only really help the community get to see the necessary dental treatment that they need. Other than that, yeah, I'm just here to support this. Thank you.
Hello, Assembly members. My name is Ruth Vega. I work for Dr. David White there in Reno. I'd like to speak in favor of this bill just because, as you guys have all heard, we do have a major hygienist shortage, and that affects every dental office that I've ever worked at least. I want to tell you a brief story about a patient that has actually been affected by this directly. This patient came in, needed a health clearance due to stage 3 cancer, essentially overtaking their body. And she ended up needing oral surgery, endodontic treatment, and a very deep cleaning. She had to wait 2 months for it. And she did try to go other places, but we were actually the closest she could get in. She ended up waiting those entire 2 months. We didn't have any sooner availability, and I think that if we were able to open up the hygienist schedules, have the assistants do the scaling, have the doctors double check all of the work and everything like that, it would open up their schedules to more, essentially, more important is not the right word. Deeper work. I wouldn't say it's unsafe for us to learn. I think it's very important for us assistants to be able to grow and build and essentially not be delaying people medical care. It's very, very important, especially for people like her. It has been not just her. Just saw one last week. So please take that into consideration when you're overlooking this. Thank you.
Thank you for your testimony. You will be the last testimony in support. We've hit our time. Go ahead.
I am a retired dental assistant. I worked in dentistry for 40 years. Never wanted to be a hygienist. It's not my forte. I would rather give back smiles. And I think that the hygienists, the dentists, and the assistants need to learn to work together for our patients. So I'm asking you to please take this into consideration, and so we can give the best care we can for our kids and for our population. Thank you.
Thank you. Can you please state and spell your name for the record?
Elizabeth Wilkening, Wilkening, Elizabeth.
Thank you for your testimony. We will move to testimony in support to Las Vegas. Is there anyone in Las Vegas wishing to testify in support to Assembly Bill 334? There is no one in Las Vegas. Is there anyone on the line?
Testify in support to Assembly Bill 334. Please press star 9 to take your place in the queue.
Barry Johnston, Las Vegas. Can someone please go and hug that judge, because kids are in danger and he just hit the nail on the head. Like every other corner of medicine in the state, the Nevada Legislature has this disseminated dental care too, and the victims, the most vulnerable among us. I work with special needs charities. A few weeks ago, one of the amazing caregivers I collaborate with called me enraged and heartbroken because what's happening, we're taking nonverbal children who don't have any money, kids who can't speak, who have extreme challenges. They need angels to care for them. Hygiene for them isn't a toothbrush. It's a trained professional with patience and compassion. And what do some faceless government goon do when their teeth are starting to have issues? They don't get dental care. They rip them out. I say this again. These kids, some not even teenagers, have had their adult teeth pulled out because the state refused to pay for proper dental hygiene. Why? Because some bureaucrat decided it was cheaper to yank the teeth out. Instead of paying for cleanings and hygienes, they're now forcing these kids lifelong eating problems on top of their already crushing challenges. Where's the humanity? Where's the accountability? We need to hunt down the paper pusher who decided a budget line mattered more than the health and dignity of nonverbal children. And while we're at it, I hope that Nevada learns the names of the politicians who voted for the virtue signaling healthcare policies that sound good in press releases, but abandon our most vulnerable children and seniors like my mom.
Sir, can you please state and spell your name for the record?
Barry Johnston, BerryJohnston.
Thank you for your testimony. Broadcast, is there anyone else on the line?
You're so welcome.
Thank you, Chair Marzola and committee members. My name is Dr. Michael Britting, MICHAEL-BRITTING. I strongly support AB 334 because not only does it increase access to care, it also decreases our patients' waiting time, especially for the most vulnerable and needed, our children. Thank you for your time.
Hi, my name is Dr. Alvin Babu, ALVINBABU from Las Vegas. And then my partner here, Dr. Kamal Patel, KAMAL PATEL. We're private office practice owners here in Vegas, and we just wanted to say we're in support of this bill. We firsthand see the shortage of hygienists. As a startup, we're trying to build our practice, get patients in for their hygiene, but just because of the shortage, we haven't been able to get patients in on a timely manner.
Something we also want to bring light to is hygienists are very well trained and they're superior in terms of treating disease, active disease, and them being able to take more of the time to treat periodontal disease, which is prevalent in 40% of Americans above the age of 30, will allow more adults, more Americans getting treated with gum disease and allow our expanded function dental assistants to treat healthy mouths and help with the scaling.
And with the EFTAs, at least access to oral health care will be a lot easier because we do have patients that complain saying, why is there a long wait time just to get a cleaning? And then the other issue we have is because of the shortage, we've been looking for hygienists for a couple of months now, and we still haven't been able to locate one. The one that's with us currently, she's part-time, but we still want to open up more days. But unfortunately, we haven't been able to, hire another hygienist. And then on top of that, even with when we do request a temporary hygienist, a lot of times the posting ends up getting canceled, so we have to reschedule our patients. So this is a bill we think will really help support our patients. Thank you.
Broadcast, is there anyone else on the line?
Caller with the last three digits 715, please press *6 to unmute yourself. Caller with the last three digits 715, please press *6 to unmute yourself. Chair, there appears to be an issue with this caller. Would you like me to move on to the next one?
Yes, please.
Caller with the last three digits 785, please press *6 to unmute yourself.
Members, my name is Dr. Fan Nguyen. For the 23 years I've been in practice, I've never experienced a severe drastic shortage of dental hygienists within the last 2 years. I myself had my hygienist of 14 years recruited by another dental institution. Since then, I've had a very difficult time finding a full-time dental hygienist. I've spent thousands of dollars for staff hiring agencies, but still unable to hire a full-time hygienist. Consequently, many of my patients cannot be seen on a timely manner for the cleaning, and oftentimes I cannot get patients with dental pain in right away due to my time seeing patients for cleaning. Consequently, underlying dental disease goes untreated daily. My colleagues and I provide free dental cleaning and treatment outreach to patients in Las Vegas annually, but that doesn't help with the long-term problem with access to dental care. Having a full-time hygienist available and allowing dental assistants with advanced training to help with cleaning of calculus above the gum line would improve access to dental care for all Nevada patients. Dentists, hygienists, and dental assistants work as a cohesive team to improve and maintain proper oral health. As such, I fully support AB 334. Thank you.
Chair, we have no more callers choosing to testify in support at this time.
Thank you. We will move to testimony in opposition to Assembly Bill 334. Is there anyone here in Carson City? Please remember to state and spell your name for the record. You each have 2 minutes, and once you're done with your testimony, if you can please get up to let the next person testify. Thank you. You may begin when you're ready.
Good afternoon, Chair and members of this esteemed committee. Leah Cartwright, Leacartwright, here today for the first time on behalf of the Nevada Dental Hygienists Association, and hopefully doing right by my dear friend Nina and channeling her appropriately. I'm here today to let you know that the Dental Hygienists Association supports Sections 1 and 2. These will help bring more dental hygienists to our area. There are some concerns with Section 3. In 2023, and I was not part of this, the bill passed that allowed these expanded function dental assistants. To date, we still have 0. I just wanted to get that on the record, that there are no expanded function dental assistants currently in the state, so changing their scope of practice at this stage seems premature. I would also add that bringing more hygienists into the state should be our #1 priority at this point, and also increasing access to proper dental care, which would include things like fluoride. There's only 1 county out of 17 in our state that have fluoride in the water, and we see tons of kids who have dental decay due to that. So there are other options we can look at before we create a new license type in Nevada, and I will turn it over to our subject matter experts here. Thank you.
Good afternoon. My name is Annette Lincicome, ANNETTELINCICOME, and I'm very privileged this afternoon to offer testimony in place of Lancette Van Gelder, who is unable to be with us today. She has been practicing dental hygiene in the state of Nevada since 1998. She says, "Dear members of the Assembly Committee on Commerce and Labor, as President-elect of the American Dental Hygienists Association, representing 228,000 dental hygienists nationwide, I strongly oppose AB 334. This bill compromises patient safety by expanding the scope of practice for dental assistants without evidence to support its safety or effectiveness. Nevada communities deserve high-quality care from qualified providers. AB 334 allows individuals with very limited education to perform dental hygiene services without the necessary skills to prevent harm. In previous sessions, Nevada established clear standards for dental assistants, yet this bill recklessly expands dental assistance scope to include procedures that could permanently damage tooth structure and ignores the importance of subgingival biofilm removal for the oral systemic health. Proponents argue 334 addresses workforce shortages, but data shows otherwise. The American Dental Association's fourth quarter 2025 report found that only 31.7% of dental practices were seeking a hygienist in the last 3 months, and only 12.7% reported being too busy to treat all patients requesting appointments. Further, joint data from the American Dental Association and ADHA shows workforce issues stem from workplace culture, lack of benefits, and professional barriers, not a lack of qualified providers. The ADHA is leading efforts to strengthen the workforce while maintaining patient safety. In contrast, AB 334 introduces an untested model that lacks national support. Even the American Dental Assisting Association and the Dental Assisting National Board have raised concerns over competency, training, and patient risk, and state there are no educational standards or testing
If you can wrap up your testimony.
examinations that include these skills for dental assistants. Thank you very much for your time.
Good afternoon, Chair and committee members. My name is Karen Soley. I've been a registered dental hygienist for 54 years. The Nevada Dental Hygienists Association supports Sections 1 and 2 of AB 334, as we recognize the need for more qualified healthcare professionals to practice in Nevada, and we encourage multiple efforts toward that goal. On behalf of the Nevada Dental Hygienists Association, I am expressing our opposition to Section 3 and only 2 lines of that, line 11 and line 12 of this bill. In 2023, the Nevada Dental Association and the Nevada Dental Hygienists Association collaborated during that legislative session on Bill SB 310, creating the expanded function dental assistant and outlining their restorative duties for this new entity. Section 3, Item 11 was very much discussed during that compromise, and the wording that we came up with is what is in the original bill. We are asking that you please retain that portion of it that says, quote, the EFTA can use the ultrasonic scaling unit only for the removal of bonded agents, and that this subsection does not authorize an EFTA to use the ultrasonic scaling unit on any natural tooth, unquote. The rationale for that original language was to assist the dentist in the restorative portion of the dental practice and to remain safe for the patients. In Section 3, Line 2, the wording for coronal scaling, which means above the gum line only, has no proven health benefit or health outcome for the patient. I'm going to skip a little bit of my pre-stuff there for you because of time. So this bill does not address the education that the EFTA would need to learn these skills, and there is, again, no EFTAs available in the state of Nevada, and we have actually no schooling already in position. Additionally, we ask, will the patients be informed that they are receiving only...
Ma'am, if you can
Yes,
wrap
ma'am.
up your testimony.
Yes, thank you.
Thank you.
Patty Sanford, P-A-T-T-I, S-A-N-F-O-R-D. Good afternoon, Madam Chair and committee members. Thank you for hearing my testimony. As a dental hygienist for the last 45 years and a full-time professor and clinical education coordinator of dental hygiene for the last 20 years at Truckee Meadows Community College, I strongly oppose AB 334, especially regarding the issue of coronal scaling and the use of ultrasonic scaler by an expanded function dental assistant. I will speak to the education of a dental hygienist. Dental hygiene programs in Nevada are Bachelor of Science degree programs. 2 years are completed in prerequisite courses heavy in the sciences, and 2 years, or about 2,500 hours, are completed in the program. Over 500 of these hours are in direct patient treatment in a clinical setting. TMCC has 20 dental units and they treat the public. In the first year of the program, students spend 12 hours per week in direct patient treatment, and in the second year, they spend 16 hours per week. Many hours are spent prior to that, learning the skills necessary for competent and safe treatment of a real-life patient. Scaling teeth is a very complex skill that requires many hours of training and practice. If we could do it in less time, we would. Even with all of that, we are educating the students to minimum competency, providing a good foundation. The important point is that this foundation is critical for future growth. The lack of training for a dental assistant to provide coronal scaling gives no foundation to build on, no assurance of quality care, and a potential risk to the patient health. In regards to perceived shortages of dental hygienists, while TMCC lacks the facilities to make a large increase in class size, they have increased their class size from 14 to 18 students in the last 2 years. And this is an increase from 12 students in recent years prior to that. Efforts are definitely being made to increase dental hygiene graduates. They are also looking to expand their facilities. When you make an appointment to get your teeth cleaned or scaled, you expect that is what you will get. And the clinician providing the service is competent and safe, and that you or your insurance company are being billed for the service that you receive.
Ma'am, can you wrap up your testimony,
Someone
please?
who is not trained cannot provide the service. I urge you to reject AB 334 in favor of more professionally trained clinicians.
Thank you for your testimony. Please remember that you can also submit the entirety of your testimony in writing to the committee secretary. Thank you. We will move to testimony in opposition to Assembly Bill 334 in Las Vegas. Is there anyone in Las Vegas that wishes to testify in opposition? Please remember to state and spell your name for the record. You have 2 minutes. You may begin when you're
Good
ready.
afternoon. For the record, Antonio Ventura, Antonio Ventura. I'm a licensed dental hygienist. I'm here representing the Nevada Dental Hygienists Association. I'm also a faculty member at UNLV's dental school. So I teach over 360 dental students on how to clean teeth. My opinions today are only representing the Nevada Dental Hygienists Association. I'm here to oppose AB 334. As a registered dental hygienist and a dental hygiene educator, I support high quality evidence-based dental care, which I believe this bill fails to do. AB 334 seeks to allow expanded functions dental assistants to practice dental hygiene without completing the same extensive education and clinical training needed to perform these specialized dental services. I strongly believe this poses a risk to public safety and places Nevada's oral health at risk. One of my biggest concerns with this bill is it's not evidence-based. It's not found on any research or anything like that. Coronal scaling or above the gum scaling is not an effective way in preventing or managing dental diseases. Exclusively coronal scaling above the gum line fails to yield favorable patient outcomes. In layman's terms, it's like popping a pimple and not getting everything out, or sweeping your house and not getting underneath the couch. Comprehensive dental hygiene care, teeth cleanings, involves the removal of calculus, plaque, both above and below the gum line. Yes, even on healthy patients. Yes, even on gingivitis patients. Any dental professional that disagrees with that statement does not fully understand the periodontal disease processes. As an educator, I've been teaching these dental students how to scale, and you can see how difficult this actually is. It seems simple, but it's not. I also want to make it very clear that the Nevada Dental Association does support FDUS. We see their value. They can place fillings because they learn how to place fillings. They can adjust dentures because they learn how to adjust dentures. We don't think they should clean teeth because they don't learn how to clean teeth. Their education is restorative functions. They don't learn how to clean teeth. So we're just seeking that anybody that seeks to perform these services just has a high level quality.
Sir, can you please wrap up your testimony? Your time has
Yes,
concluded.
I just want to oppose. Thank you. AB 344. Thank you for your time.
Thank you. Is there anyone else? You may begin when you're ready.
Hello, my name is Olivia Jensen. I'm with the Nevada Dental Hygiene Association. I'm here to strongly oppose this bill as well. I am a recent graduate from May of 2024, and I was one of 13 who graduated from my program. 20 were accepted. I say this because the class behind me, who is graduating in May, have only 12 students. We do have a drought of hygienists, but the solution is to increase access to education, increase the amount of graduates we put out, and not to lower the quality of dental care. we were not able to use an ultrasonic a year into our program because of the damage that it can do on teeth if not used correctly. And like previously stated, we have no FDA programs here in Las Vegas. We do have dental hygiene programs. If you guys want more hygienists for our valley, then we need to start looking there because there's a big gap for for students to be graduated. So I oppose this bill. Thank you very much.
Hi, this is Nichelle Venable, NICHELLEVENABLE. I've been a hygienist for 14 years, also past president of the Nevada Dental Hygienists Association, been in dentistry for almost 20 years, was an assistant for years. I fully support Section 1 and 2. However, I do oppose the section that allows FDA assistants to scale. I do want to correct the Nevada State Board. According to Nevada State Board, we are listed at dentist count of 2,333 and hygienist count of 1,551. We do not know how many assistants we have. It's not an accurate number because there is no regulation here in Nevada. You can work at Starbucks and the next day you can be a dental assistant. Over the course of my career, I've consistently observed a lack of full appointments of prophylactic patients. The primary challenge we face is limited access to care for majority of population who require 3 to 4 month cleanings to manage their disease. I would like to add that as a regional manager for a company who has 50 offices in Las Vegas, we have no problem getting patients in for same-day treatment and for deep cleanings to address their needs. This bill may inadvertently actually create new challenges such as prevalence of infection due to inadequate removal of plaque and tartar. The true problem here is our hygiene programs. I have to address Mr. Klein's information as the young lady addressed before me. We are on average graduating 12 students. If we were graduating 40 annually, we would definitely not have a deficit. Research from the ADHA has shown that dental hygienists have left the profession due to lack of benefits, retirement benefits, and unfavorable work environments. I hear the concern for children and special needs adults. Rural areas and underserved communities have got to be treated. This is not a hygiene shortage situation. This is a situation where many of our dental professionals do not take Medicare or Medicaid, are willing to open up any kind of nonprofits or public health programs to address that situation. There are a few dentists in our state who do take Medicaid, and those who do are overwhelmingly having issues getting their patients in. Places like California, Colorado, Montana, Arizona have amazing programs to run publicly endorsed hygienists to address those needs. I truly believe that we can address this situation if we come together and get to the root of the problem, which is implementing some kind of funding to
Ma'am, can
really
you please wrap
help
up your
our
testimony?
Yes, to really help our hygiene programs in Nevada accept more hygiene students, and we can produce more hygienists to treat disease. Thank you.
Thank you.
Good afternoon, Chair and members of the committee. My name is Lillian Brainer, Lilianbraner, and I am a registered dental hygienist. I am strongly opposing Section 3 of AB 334. This will jeopardize patient safety and have a direct negative impact on their oral health. As we've mentioned, dental hygienists go through a rigorous CODA-accredited program that sets the standards for producing safe, skilled, qualified, and knowledgeable clinicians to treat the public. For the sake of public safety, it would be extremely irresponsible to allow unqualified clinicians to perform the duties of a state licensed and registered dental hygienist. As we've highlighted, there are currently no FDA programs here in Nevada. The states mentioned earlier, Kansas and Illinois, where assistants are able to scale, their law requires that a dentist or a dental hygienist complete the cleaning if there's anything below the gums. This is time consuming and not an effective use of time in an already busy environment. This may decrease waiting times for patients to get cleanings, but it will increase the patient load for the dentist and dental hygienist. A coronal cleaning is essentially brushing your teeth. Anybody with a toothbrush is able to get the plaque above the gum line. And if they are not able to get it, what assistants can do in our offices is do a coronal polishing, just a tooth polishing that will effectively remove that above the gum line plaque. So I am just asking you, when taking this matter into consideration, I urge you to think about your own healthcare providers and if you would want an unqualified and unregulated individual in charge of your health. Thank you.
Good afternoon. My name is Gloria Silva, Gloria Silva. I am a registered dental hygienist since 2011. I am strongly opposed to Section 3 of AB 334 for several reasons. One of my biggest concerns, which was actually brought up earlier with one of the assistants that was supporting the bill, is the fact that they use a handpiece in the mouth. Dental assistants in the state of Nevada are not allowed to use a handpiece in the mouth. So it's very, very concerning to me that that's happening. But I'm sure it's happening nationwide. And my biggest concern is, while it's already happening and they haven't had that completely passed in the state, that giving them just a little bit more leeway, it might not be long before they're actually scaling subgingivally, which can cause a lot of irreversible damage to the tooth structure and the soft tissue. So that is one of my biggest concerns. Again, to reiterate what was stated earlier, they're also not trained to do any type of cleaning. Their biggest training is in restorative functions and aiding the doctor in the procedures that they do. So they have no knowledge of periodontal disease or in the slightest sense, or the extensive, which is really what we want to make sure that they don't start delving into. Also, dental assistants they don't need anything to actually become a dental assistant. They can be trained in the office. So I'm not sure where we're getting the numbers of how many assistants we actually have in the state of Nevada, because they don't register anywhere. So how can we keep a head count if it's not regulated in any capacity? And then there is a much larger shortage of assistants than there is actually dental hygienists throughout the nation. So I'm not sure how this would actually solve any of the issues that we have, because there's already a shortage in them as well. So I highly encourage you to really take into consideration the greater good, what dangers we can potentially bring to patients if we allow somebody who's completely untrained to see patients for these procedures. And I hope that you also oppose this bill. Thank you.
Thank you for your testimony. You may begin when you're ready.
Awesome. Hi, everybody. My name is Patrick Felt, Patrick-Felt. I'm a dental hygienist from 2014. I'm just representing the dental hygiene community. I temp a lot across many offices across the valley, and I see a lot of abuse happening with insurance codes and stuff like that. And just to back on the last presenter, that I believe that many that they will push to do subgingival scaling. And I believe that's a harm to the patient. And, if you're thinking about your family as well, you would want them to be treated by a registered dental hygienist. I also see a lot of gaps in my schedule. Sometimes I have lunches of 2+ hours because I don't have patients. So I think there's something misleading about saying that there's a dental hygiene shortage right now in our community. I think that dentists are not providing the culture and atmosphere for a dental hygienist to be a permanent member of their staff. I think they need to give them more as far as benefits and incentives to want to stay permanent versus being a temp hygienist, because we do actually get paid more being a temp hygienist. So it's better for us to just move around when we can. I am opposed of AB 334, and that's all I have.
Thank you for your testimony. I don't see anyone else in Las Vegas broadcast. Is there anyone on the line?
To testify in opposition to Assembly Bill 334, please press star 9 to take your place in the queue. Again, if you wish to testify in opposition, please press star 9.
Hello, my name is Jessica Wilson, Wilson. I'm a registered dental hygienist here in Las Vegas, Nevada. There are a couple of things that I have in opposition to this bill that were spoken on earlier. One of such is that there would be checking of the dental assistant's work after they coronal scaled or used ultrasonic. As written, this bill does not actually indicate that that would be necessary. Therefore, there is nothing that would require a dentist to go in and check that this has been performed and been performed adequately. Secondly, it does not give any indication in the writing of this bill that the ultrasonic device could be used only coronally, because it removes any limitation to the use of the ultrasonic device for the expanded functional dental assistant. I'm sorry, I am a little sick today, so I'm calling in from home with the flu. There is also a dental hygiene shortage in Nevada, and I do also agree with some of the other speakers that this is a slightly less than true statement, as I myself also have large gaps in my schedule occasionally, and often I am seeing 3 or 4 patients a day extra in order to see patients that day, and I am able to do that with the assistance we have now. So again, I am in opposition of this bill. Thank you.
Hello, my name is Angela Martin, Martin. I am the current Southern Nevada Dental Hygienist Association president and have been for the last 3 years. I wanted to call and send in my opposition for AB 334. I am in favor of sections 1 and 2, but 3 as well I have an issue with, as there is obviously not enough language surrounding anything in there to where it's just changing it to coronal scaling and allowing the assistants to use an ultrasonic scaler. I would like to note that in my 21 years of dentistry, including of being an assistant myself, I have never seen an assistant pick up an ultrasonic scaler to remove any bonding agents from any teeth in my viewing in general practice. Not to say that they might not elsewhere, but the Captioning use, the ultrasonic scaler, can be quite harmful to patients if it's not used in a correct manner. In fact, it can cause the necrosis of the nerve inside of the tooth if it's not moved quickly enough due to the power it exudes. Not only in that situation, but scaling the tooth is actually not something that is under CODA, which is the Commission on Dental Accreditation, that's sponsored by the ADA. It is not under the standards of education for dental assistants. In section 2-11, CODA accredited dental assistant programs are required to have assistants do other functions, and A through letters L do not include any type of scaling in any form or using an ultrasonic scaler. I would like to note, in addition to that, I would like to mention the standards for dental hygiene education coming from CODA. We actually, as dental hygienists, are required to do so many hours of education. Our hours of everything that we do, including clinical time, is actually a lot more than the dental assistant program, unlike somebody said previously.
Ma'am, if you can please wrap up your testimony.
Yes, thank you very much. I appreciate it and oppose AB 334. Thank you.
Thank you for your testimony. Broadcast, is there anyone else on the line?
If you have just joined and would like to testify in opposition to Assembly Bill 334, please press star 9 to take your place in the queue.
Good morning. My name is Hannah Lee, Hannahlee. Thank you for hearing us today. I am speaking as the president of the Nevada Dental Hygienists Association and a part-time clinical instructor at TMCC. I am in opposition to AB 334 for many reasons. Sections 1 and 2, I am in favor of, and the Section 3 in regards to coronal scaling and ultrasonic use of EFTAs, I am in opposition to. I speak on behalf of all of my members in opposition. And as a part-time instructor, I see the stages that these students have to go through to become proficient in their skills with scaling above and below the gum line with both an ultrasonic scaler and with hand instruments. And I also went to school at TMCC through the dental assisting program. And I do not believe that with the skills I received and learned that I would be capable of providing the proper skill set and provide patient safety for their oral health and overall health. Again, I'd like to speak in opposition for AB 334. Thank you for listening to me today.
Broadcast, is there anyone else on the line?
Chair, we have no more callers choosing to testify in opposition at this time.
Thank you. We will move to testimony in neutral. Is there anyone here in Carson City wishing to testify in neutral? I don't see anyone. Is there anyone in Las Vegas wishing to testify in neutral? Broadcast, is there anyone on the line?
To testify in neutral for Assembly Bill 334, please press star 9 to take your place in the queue.
Good afternoon, committee member. Again, Dr. Fan Nguyen. AB 334 allows for immediate licensure of dental hygienists from other states. So this will significantly improve the amount of hygienists we have in Nevada. 2, the extended function program has not been made yet. So we can teach these assistants to learn how to scale super gingerly. Anyone can be taught with time. If we do it properly, this will add to the regimen that we can do to help our patients within the valley.
Sir, are you testifying in neutral to Assembly Bill 334?
Chair, the caller hung up. I will move on to the next one.
Thank you.
Caller with the last 3 digits 320, please press star 6 to unmute yourself. Again, caller with the last 3 digits 320, please press star 6 to unmute yourself. Chair, there appear to be problems with this caller. Would you like to move on?
Yes, please.
We have no more callers to testify in neutral.
Thank you. Assemblymember, would you like to give a very brief final remarks?
Assemblymember Merzola, committee members, my name is Dr. Amy Abitian. For the record, I am a private practice dentist in Reno. I am also the vice president of the Nevada Dental Association, speaking on behalf of them today. I would like to respond to some of the points in opposition that were made. The expanded functions dental assistant license type was created in 2023 in the last session, as you all know. Regs are still pending. They're still with our licensing board. We are still waiting for the completed set of regs. Once those regs are complete, we have TMCC and CSN with Ready, Set, Go programs. The curriculum is already lined out. Those programs are literally ready to start the minute those regulations are complete. So expanded functions dental assistants can start matriculating very soon, as soon as we get that regulatory process done.
Direct supervision is paramount, is a huge part of the expanded functions dental assisting program. Any expanded functions dental assistants must be directly supervised by a dentist. Their work must be checked. Their work is to be under our liability, under our licensure. Anything that they do, we have to be comfortable with their competency in our office. As the dentists, we are the backstop for public safety, for dental safety in our offices. The buck stops with us. It's what we do. We provide the safety. We ensure that all of our dental assistants, hygienists are working up to par with our expectations. We're constantly monitoring the work that we do in order to maintain the best standards for everybody in our office. I want to really highlight that there is a difference between dental assistants and expanded function dental assistants. Our dental assistants are trained in our offices to our comfort levels to make sure that they are safe to work. But the expanded functions dental assistants, as I mentioned previously, are the ones who are so passionate about this field that they want to go and receive extra training, be able to have extra skills, and be able to help their patients more than just the dental assistants. They are licensed, and this is another layer of safety in our offices.
Assemblywoman Heidi Kasama. I just want to thank the co-presenters. I'd also like to thank my co-sponsors on the bill, Assembly Members Urick, Hardy, and Koenig as well. And I appreciate the robust discussion that we've had on the bill. And just as a quick reminder, what does the bill do? It's streamlining the application process for dental hygienists to come from other states, and it also provides for the FDIS for an expanded function as was created in the 82nd session. And with that, Chair, I thank you for your patience, your time, and all Assembly members, and encourage you to support AB 334. Thank you.
Thank you. I will now close the hearing on Assembly Bill 334. I will now open the hearing on Assembly Bill 318, which revises provisions relating to captive insurers. Assemblymember Hardy, you may begin when you're ready.
Good afternoon, Chair Marzola, Vice Chair Hadigi, and members of the Assembly Commerce and Labor Committee. For the record, my name is Assemblywoman Melissa Hardy, and I represent Assembly District 22 in Henderson and South Las Vegas. I appreciate and am grateful for the opportunity to be here today to present the captivating bill, Assembly Bill 318, with legislation designed to provide Nevada businesses with an additional optional pathway for securing workers' compensation coverage through captive insurers. Nevada has established itself as a premier jurisdiction for captive insurance, consistently ranking among the top domiciles nationwide. This legislation strengthens Nevada's competitive position by expanding captive insurers' capability to include direct workers' compensation coverage. By expanding opportunities and enhancing our competitive position, we will attract additional captive formations to our state. Assembly Bill 318 specifically authorizes captive insurance companies to directly write workers' compensation policies, offering Nevada businesses greater flexibility and more control over managing their insurance needs. Importantly, this bill does not mandate any changes to existing workers' compensation arrangements. Businesses remain free to maintain their current coverage or pursue this alternative option. We recognize the diverse ways Nevada businesses currently secure workers' compensation insurance through traditional insurance carriers or self-insurance groups, and this bill is not intended to diminish the valuable role these groups play. Instead, AB 318 simply expands the options available to businesses seeking customized solutions for managing risk, reducing insurance costs, and enhancing worker safety. Nevada would not be pioneering this approach. Over 20 states already allow captives to provide some form of workers' compensation coverage, and states like Illinois, Hawaii, Arkansas, and Ohio have implemented similar provisions. Captive insurers authorized under AB 318 would continue to be subject to stringent regulatory oversight, including financial solvency standards, reserve mandates, and comprehensive reporting obligations. The Nevada Division of Insurance carefully reviews and approves each captive insurer application, ensuring that only financially sound and properly managed entities are permitted to operate in this space. From a broader perspective, this bill strengthens protections for injured workers by reinforcing financial safeguards and providing additional regulatory oversight. It also clarifies that captive insurers may participate in Nevada's Guarantee Fund, providing injured workers with an added layer of financial protection in the rare event of insurer insolvency. Ultimately, AB 318 offers Nevada businesses an additional voluntary tool to effectively manage their workers' compensation needs, focus on risk management, and further protect their workers. I'm pleased today to have with me Ms. Elena Martinez, an expert in captive insurance, and Matt Morris, an attorney from Holland & Hart. They will provide further details on captive insurance, the mechanics of AB 318, and outline the conceptual amendment we are proposing, which I believe you all have a copy of. Thank you again for this opportunity and your consideration, and I'll now turn this over to Elena.
Thank you for your time today, Assemblymember Marzola, members of the committee. My name is Elena Martinez, ELENA MARTINEZ. I'm a compliance and regulatory manager, and I help oversee a captive insurer in Hawaii, and I've had the privilege to testify and present on insurance matters in both Hawaii and California, and I'm excited to be here today. Thank you. AB 318 revises provisions relating to captive insurance. And what is a captive insurer? So we have the word captive. It creates a separate insurance company to provide insurance coverage for a parent company and affiliated entities, and in some cases, unaffiliated entities that are under common control. It is a private insurance company subject to existing regulation under NRS 694C, administered by the Nevada Division of Insurance. The captive structure is very beneficial. It allows a company to retain earnings from premium payments, fund additional investments, and cover expenses for safety programs and research and other uses. Nevada has a great history with captive insurance. Since 1999 is when the initial law that allowed the formation of captive insurers into Nevada. Nevada law allows for competition with other states to attract captives to this domicile using relatively low application expenses and renewal fees and a simplified financial reporting structure, all under the oversight of the Division of Insurance. But what are the benefits to captive insurance in the state of Nevada? It provides low-cost alternatives to traditional insurance in the open market. So in this economy, employers can potentially save a little bit of money through lower overhead. The captives do this through lower overhead and streamlined operations. Increase control and reduce costs. Captive insurance allows companies to tailor their coverage specific to their business needs, which further reduce their premium costs and provide more streamlined coverage for their employees. Improved risk management. Captives only insure similar risk that they can control in their pool. Captive insurers can implement loss control measures to better mitigate this risk. You're not going to have skydivers mixed in with white-collar workers or light industrial workers. They're going to be very tailored to the type of businesses that they are in control over for the safety. Enhanced claims handling. Captive insurers can have greater connectivity and interaction with the workers through that common control of the entities and the responsibility for safety. You're not getting just the next claims adjuster. You're getting someone who has a vested interest in making sure that the worker is able to heal and return to work or have light-duty accommodations as soon as possible. There are great economic benefits to captive insurance. The operation of captive insurance can draw more domiciles and businesses to the state of Nevada. Jobs are created to help manage the captive and expand that third-party administrative function and increase tax revenue of up to $175,000 per year per captive and other investment in the local economy. So we hear sometimes captive insurance versus self-insurance. Are they the same thing? Is it different? Well, while there are some similarities, captive insurance and self-insurance, insurance in general, they're all forms of risk transfer. Self-insurance more refers to a company or a group of companies that form an association to set aside funds to cover their losses. A captive insurer is really structured like a traditional insurer. It's a separate bona fide insurance company that just tailors to the parent and affiliated and controlled entities. There are many regulations, regulatory requirements and oversights of captives. There's reporting, an annual audit every 3 years, financial reporting every year, a solvency study and a feasibility study to even apply to be a captive. And all the approval is under the jurisdiction of the captive commissioner and the Division of Insurance. There are capital, surplus, and reserve requirements for captives, whereas sometimes in self-insurance you don't get that. It's just a different model. And I think that's the important thing, is that it's just a different way to procure the coverage that a business needs. So there's traditional insurance. You can go to ABC insurance carrier. You can self-insure if the line of coverage you wish to afford is allowed under self-insurance in your domicile, or you can go through a captive insurer. So it's just a different form. We're not saying one is necessarily better than the other. It's just a different form. And currently Nevada has a number of different types of captives that can be formed. And today we're speaking about a pure captive being able to direct write workers' compensation. Captive insurance law authorizes the insurance commissioner to prescribe additional requirements for capital, surplus, and other safety requirements. So we're happy to be here today to talk about those requirements and how captives can benefit the state of Nevada.
So thank you, Chair Marzola, Vice Chair Howdigee, members of the committee. My name is Matt Morris, M-O-R-R-I-S for the record. I'm going to walk through AB 318 for the committee. Before I do that, I just want to note that there are a number of states that have in their respective statutes what we're proposing with AB 318, which is to allow a captive insurance entity to directly write workers' compensation insurance. Hawaii, Illinois, Arkansas, Ohio, Tennessee, District of Columbia, and Virginia all have similar provisions in their respective statutes. So as I walk through AB 318, I wanted to just start with kind of an overview of what the captive insurance market looks like in Nevada. And so the graph that you're looking at shows that the most recent data that we have is pre-COVID data. There were about 200 or so captive insurance entities in Nevada. Captive insurance entities are formed across a variety of industry sectors, from agriculture and mining to medical and healthcare, to banking, finance, and insurance. But far and away, the majority of captive insurers in Nevada are in the banking, finance, and insurance sectors. Currently under NRS 694C 300, a licensed captive insurer may transact any form of insurance that is listed in existing statute with certain exceptions. And this means that a captive insurer may provide casualty insurance, which refers to what you'd think of as general commercial liability and related types of commercial insurance, as well as life, property, and title insurance, among others. And those types of casualty insurance are listed in NRS 681A. Workers' compensation is explicitly included under existing law as a specific category of casualty insurance, and that's NRS 681A 020 sub 1C. But it is less clear that a captive insurer may direct write workers' compensation insurance, in other words, to provide workers' compensation insurance directly to an employer under NRS 694C 300. A captive may reinsure workers' comp or provide excess workers' compensation under existing law. But the primary intent behind AB 318 is to clarify this statute to explicitly refer to a captive insurer's ability to direct write workers' compensation insurance, which again is already identified under NRS 681A 020 as a form of casualty insurance. And that is the proposed language that you see in Section 1 of AB 318 to clearly say that a captive insurer may directly write workers' compensation insurance. Section 2 would propose an additional safeguard in the event that a licensed captive were to be insolvent or otherwise unable to pay its claims. AB 318 would authorize, but not require, the insurance commissioner to allow a captive to join or contribute to an assigned risk pool or the Nevada Guarantee Fund, if appropriate. And I just want to make clear that this is enabling legislation. It is intended to allow regulators to permit this if it's appropriate for a particular captive in order for it to provide workers' compensation coverage. That's the language that you see in Section 2. Finally, AB 318 Sections 3 and 4 include conforming changes to the existing definition of private carrier for purposes of Nevada's workers' compensation statutes under NRS 616A. And these changes explicitly refer to a captive insurer that provides direct workers' compensation coverage and to the regulatory criteria that a captive insurer must already satisfy under existing law in order to obtain a license to provide workers' compensation coverage. It's important to emphasize that these conforming changes do not alter existing workers' compensation requirements that apply to Nevada employers, nor do these changes alter the Labor Commissioner's role in administering Nevada's workers' compensation laws and regulation, which are separate from the Nevada Division of Insurance. These changes simply refer back to the bill's enabling changes under NRS 694C to authorize a captive to direct write workers' compensation insurance if it meets certain thresholds. We've had extensive discussions with stakeholders regarding this proposal, going back to even before the session, and we've prepared a conceptual amendment that is intended to reflect the input that we received from regulators and from industry groups. In short, the concern that we've encountered is that because Nevada captives do not currently write this type of insurance directly, although they reinsure and they can provide excess workers' compensation coverage, and because workers' compensation is a unique form of insurance, there should be additional explicit safeguards and potentially higher thresholds for a captive to qualify to direct write workers' compensation. So the proposed conceptual amendment that you have first would require a $250,000 deposit for a captive insurer that is applying for authority to direct write workers' compensation. And that threshold is in line with other states, including Hawaii, that allow captives to provide workers' compensation directly. So that's different from a capital surplus. It's actually a deposit that a captive would pay as part of its application to the Division of Insurance. Second, AB 318 would authorize the Division of Insurance to impose a higher initial capital requirement of $250,000 if a captive applies to direct write workers' compensation. And on that note, I want to make sure that I'm clear that we're only talking about a captive that applies to direct write workers' compensation. We are not talking about existing captive entities or captive entities that apply and are not applying for authority to direct write workers' compensation. And finally, AB 318 would provide that regulators may increase either of these thresholds for a captive that applies to write workers' compensation directly, commensurate with the particular captive's risk profile and based on the Division of Insurance's review of the captive. That language is already in existing statute, but we want to make sure that it's explicit that it would apply equally to a captive that applies for authority to write workers' compensation. So in closing, as you've heard from the bill sponsor, the primary goal of this legislation is simply to authorize another option for Nevada's employers to obtain lower cost insurance and to help employers better manage workers' compensation risk for their particular business. Nothing in this bill will require an employer to pursue this option if it doesn't make sense for their particular business and for their workers. And nothing in this bill would require insurance regulators to allow a captive to direct write workers' compensation if the captive doesn't satisfy the existing criteria in existing statute for licensure. AB 318 simply makes clear that this is another option that would be available to Nevada businesses, as many other states have done in their respective jurisdictions. Chair, that concludes our presentation on AB 318, and we are happy to answer any questions from the committee. Thank you.
Thank you for your presentation today. Committee members, are there any questions? Assemblymember Yurick.
Thank you, Chair, and I really appreciate the presentation today. And I do appreciate the intent. What seems to be is to just basically expand option for workers' compensation coverage in the state of Nevada. But I definitely want to ask for some clarity, and with all transparency, I'm a workers' compensation attorney. So there's a bit of an elephant in the room that I'd like to address and make sure we can get on the record. So my question is going to be, does this bill suggest that, or would it require captive insurers to use a licensed TPA, a third-party administrator, to administer these claims? And if, or are they allowed to self-administer? And if they're self-administering, if that's the direction you're going, how can we make sure that we address the potential conflict of interest that presents itself when an employer-controlled insurer is making claim decisions that could affect its own bottom line?
Elena Martinez, for the record. That's a great question. And yes, the existing law actually mandates the use of a third-party administrator. We don't want to touch that section. We support that section because there's absolutely a conflict of interest there with, hi, I'm your HR person and I'm adjudicating your work comp claim. We don't want that at all. Absolutely. Third-party administrator is required.
Thank you, Chair, and thank you for letting me get that on the record.
Thank you for that question. I am not a work comp attorney, but that was my question as well. Committee members, are there any additional questions? I don't see any. So we will start testimony in support of Assembly Bill 318. Is there anyone here in Carson City wishing to testify in support?
Good afternoon, Chair Marzola and members of the committee. Again, for the record, my name is Taylor Avery, and I'm the Manager of Political Affairs for the Vegas Chamber. The Chamber is in support of AB 318. The bill will allow for greater market expansion of insurance options to consumers and businesses in Nevada. The entry of additional insurance products is important to the marketplace because it will expand options available to Nevadans. We'd like to thank the bill sponsor for bringing the bill forward, and thank you for your consideration.
Thank you for your testimony. Is there anyone else here in Carson City wishing to testify in support? I don't see anyone. Is there anyone in Las Vegas wishing to testify in support to Assembly Bill 318? Broadcast, is there anyone on the line?
Testify in support for Assembly Bill 318. Please press star 9 to take your place in the queue. Caller with the last 3 digits 683, you are unmuted and you may begin.
Hi, good afternoon. I'm Eva Anaya, Senior Vice President of Yes and Companies. We're a Nevada company employing 1,200 employees across multiple industries. We support AB 318 and believe it would help Nevada businesses manage their complex work comp options. I stand by our written testimony. Thank you.
Hi, my name is Justin Doucette. I am the current CFO for Kyrock USA and the former CFO for MRG Marketing and Management. We had just around 1,600 employees. We do support AB 318. We've participated in fully insured and self-insured groups in our previous business with MRG Marketing and Management. We do believe that AB 318 would increase opportunities and provide better options for Nevada companies managing workers' comp issues safely and securely. I do stand by our written testimony. We would increase opportunities and provide better options for Nevada companies managing workers' comp issues safely and securely. I do stand by our written testimony.
If you're testifying in support, we cannot understand you. Yeah, you sound really far away, so if you can please provide your testimony in writing. Broadcast, is there anyone else on the line?
If you have recently joined and would like to testify in support of Assembly Bill 318, please press star 9 to take your place in the queue. Caller with the last 3 digits 870, please press star 6, to unmute yourself.
Hi there, this is Jessica Shamoon with Obsidian HR. Can you hear me?
I can. Can you please state and spell your name?
Sure, yes. My name is Jessica Shamoon. It's Jessica, and the last name is Shamoun.
Thank you. You can go ahead and start your testimony.
Great. I'd just like to say that I'm the president at Obsidian HR. I support AB 318, and just wanted to say it really would be hugely helpful for us to help just bring stability for our clients and for us for our workers' comp costs over time versus what we're doing now. I submitted a written testimony and to the same point, and happy to provide any other detail here.
Hi, my name is David Jaramello. I'm the president of Par 3 Landscape Management. We're the largest locally owned landscape construction and maintenance company in Southern Nevada. We support AB 318. We currently participate in a workers' compensation captive group and believe allowing captives to participate in the Nevada Guarantee Fund would further enhance captive options in Nevada, and I stand by our written testimony.
Can you please spell your name for the record?
Sure. David, D-A-V-I-D, last name Jaramello, J-A-R-A-M-I-L-L-O.
Thank you for your testimony today. Broadcast, is there anyone else on the line?
Chair, we have no more callers to testify in support at this time.
Thank you. We will move to testimony in opposition to Assembly Bill 318. Is there anyone here in Carson City?
Good afternoon, Chair Marzola and members of the committee. My name is Leah Cartwright, here today on behalf of the American Property Casualty Insurance Association, APCIA. APCIA is opposed to AB 318 as written, particularly the guarantee fund in Section 2, subsection 2. AB 318 would allow the insurance commissioner to allow captive insurers into the guarantee funds. Captives are very different than admitted insurance carriers who must comply with substantial regulations to ensure financial solvency and the ability to pay claims. Captives operate under different regulations, and there may not be a clear understanding of what risks a direct captive writer would bring to the guarantee fund or the ability of a direct captive writer to take on the risks of assessments. States such as Delaware should offer a cautionary tale to adding captives to the guarantee fund. I have Mark Seknin on the phone if there are questions about captive insurers and guarantee funds, as I am not an expert, but happy to be here in person with you this Friday.
Is there anyone else in Carson City wishing to testify in opposition? Is there anyone in Las Vegas that wishes to testify in opposition to Assembly Bill 318? Broadcast, is there anyone on the line?
To testify in opposition to Assembly Bill 318, please press star 9 to take your place in the queue. Chair, we have no callers choosing to testify in opposition at this time.
Thank you. We will move to testimony in neutral. Is there anyone here in Carson City that wishes to testify in neutral to Assembly Bill 318? Is there anyone in Las Vegas that wishes to testify in neutral? Broadcast, is there anyone on the line?
To testify in neutral to Assembly Bill 318, please press star 9 to take your place in the queue. Chair, we have no callers choosing to testify in neutral.
Thank you. Assembly member, would you like to give any brief final remarks?
I just want to thank you, Chair and Committee, for your attention today on this bill, and I ask for your support of AB 318. Thank you.
Thank you. I will now close the hearing on Assembly Bill 318. 1 minute recess.
The committee will now come back to order. I will now open the hearing on Assembly Bill 143. Chair Marzola, when you are ready, please begin.
Thank you, Vice Chair Howdigi and members of the committee. For the record, I am Elaine Marzola, representing Assembly District 21 in Clark County. I am the sponsor of Assembly Bill 143, which enacts the Dentist and Dental Hygienist Compact, or DDH Compact. The Compact Commission reports there are approximately 200,000 licensed dentists and approximately 215,000 licensed dental hygienists in the United States. In Nevada, there are 2,332 dentists and 1,551 dental hygienists licensed by the Board of Dental Examiners of Nevada. The number of licensed dentists and dental hygienists practicing in Nevada is small. Like other licensed professionals, there is a shortage of dentists and dental hygienists in Nevada. The DDH Compact seeks to provide licensees with opportunities for multi-state practice and increased mobility for individuals who are relocating to Nevada. This measure promotes workforce development and strengthens our labor market by reducing unnecessary burdens to obtain a license. In addition, AB 143 improves public safety through a shared interstate data system of licensure and disciplinary information and allowing for rapid verification of licensure status. Vice Chair, to provide further testimony, I would like to introduce the following industry experts. I have Chris Anderson, who is the president of Sala Consulting, here with me, who will provide an overview of the compact. I also have, that is not Matt Schaefer. We have Jessica here from CSG. And we should also have on Zoom Kelly Mae Douglas, who is with the United States Department of Defense. And with that, Vice Chair, with your permission, if I could please turn the presentation over to Mr. Anderson.
Thank you, Chair Marzola. Chris Anderson, for the record, CHRISANDERSON. On behalf of my client, the Association of Dental Support Organizations, which partners with over 120 dental practices in the state of Nevada. We'd like to thank Chair Marzola for sponsoring this compact and for her leadership to improve access to dental care in Nevada. Why should Nevada join this compact? You've heard earlier today in other presentations extensive commentary on the dearth of dental providers in the state of Nevada. To further illustrate that point, I would direct your attention to the last page of our supporting documents for this bill. That's the latest Gwynn Center report on dental care in the state. You'll notice that every county in the state of Nevada that's been assessed by the federal government contains areas designated as dental health professional shortage areas, or HSPAs, including high priority dental deserts in Washoe County, Clark County, and here in Carson City. This compact will not only benefit Nevada's military families, as you'll hear from the Department of Defense, it will also allow professionals from compact states to augment and backfill our lagging workforce, ultimately offering patients greater access to care. You'll notice this is an active compact. There are 10 states that have joined, and some of the states that have joined are natural feeder markets to Nevada. Washington State, we have a lot of back and forth with that state. Oregon, Minnesota, Iowa, a lot of retirees and families that visit Nevada, as well as Colorado. I would just call out, I have family in Minnesota actually. I have a cousin who's getting ready to enter dental training. Her family just visited Las Vegas 2 weeks ago, and she's public service minded. I am pretty confident that she would like to have the opportunity to come to underserved areas in southern Nevada and maybe northern Nevada as well, and help see some of those underserved patients. So this is a tremendous opportunity for the state to quickly and safely bring new practitioners into Nevada. I'd like to thank the committee and your dedicated staff, especially Logan, for your assistance today. And I appreciate your time and consideration. Jessica with the Council of State Governments, are there any comments you would like to add?
Yes, I'd love to. Thank you. Thank you, Chair, Vice Chair, members of the committee. Good afternoon. My name is Jessica Thomas, JESSICA THOMAS, with CSG, the Council of State Governments. Sorry, Chair, about the last minute switch. Matt was unable to make it, but I'd like to provide some educational information on Assembly Bill 143. CSG has facilitated the development process for all 18 of the active licensing compacts, including the 5 that Nevada is a member of. You've heard a little bit of background. I just want to touch on 3 points here. So 1, the compact enables dentists and dental hygienists to obtain a compact privilege to practice in other states that join the compact, rather than apply for individual licenses in each state that they wish to practice. Each compact member state agrees to mutually recognize that practitioner license that's issued in the other states. Dentists and dental hygienists must meet requirements outlined in the compact in order to use it, including holding an unencumbered license in a compact member state and meeting education and exam requirements. Second, from a regulatory perspective, each compact member state maintains authority to protect public health and safety through the existing state regulatory structure. So a licensee that's practicing under a compact privilege must abide by the laws, regulations, and rules that govern the practice of dentistry or dental hygiene in the state that they are practicing. So the Nevada State Board of Dental Examiners has jurisdiction over anyone practicing in Nevada under a compact privilege, and they can take action on that privilege just as they can a license. And then third, we don't anticipate substantial additional costs for states participating in the compact. There may be a cost if Nevada requires additional software to connect to the compact's interstate licensure data system, as well as costs associated with the attendance of your chosen commissioner to the annual commission meeting. However, so far, the commission has chosen to also include that virtual option, so commissioners don't need to travel. The compact language allows the commission to assess a state fee, but they have not done so. Only 2 compact commissions out of the 18 actually charge a state fee. They try to avoid that. And also, Nevada is able to charge a fee for the compact privilege, so you can set your own fee, and that can help offset any costs. The compact has been enacted in 10 states, and there are currently 16 states with pending legislation this year. Thank you for your time.
Vice Chair, with your permission, if we can have Kelly Mae Douglas.
Ms. Douglas, when you're ready.
Thank you. Good afternoon, Vice Chair Hadigi and members of the committee. My name is Kelly Mae Douglas, and KelliMayDouglas, and I work at the Defense State Liaison Office within the Office of the Undersecretary of Defense for Personnel Readiness. On behalf of the U.S. Department of Defense and over 50,000 military service members, spouses, and children stationed in Nevada, I would like to share why we support the policy changes expressed in Assembly Bill 143, a measure to enact the Dental and Dental Hygienist, or DDH, licensure compact in the state. As I've stated before in my testimony in support of several other compact measures under consideration in your committee, professional licensure has been an enduring problem for military spouses over the years. The short duration of military assignments, usually 3 to 4 years, coupled with lengthy relicensing processes, can discourage military spouses from seeking relicensure, causing them to quit an occupation or pause their career for the time that they're stationed in the state, or for the service member to decide to leave the military. After over a decade working with states to modify licensure policy to assist military members and their spouses, we have identified licensure compacts such as the DDH compact as the optimal mechanism for creating true reciprocity across state lines for licensed professionals moving across or between states, while also providing embedded guardrails for the state. And in adopting this compact, Nevada can increase its pool of highly qualified healthcare professionals to include military spouses to serve the community while also supporting military families stationed in the state. The department is grateful for the tremendous efforts that Nevada has historically taken to support the needs of our military families in the state, and we appreciate the opportunity to support the provisions within AB 143. Thank you, Chair Marzola, for spearheading this effort.
Elaine Marzola, for the record. Vice Chair, would you like me to provide a summary of each of the section of the compact?
That would be helpful. Thank you, Chair.
Section 1 summarizes the purpose of the compact. Section 2 establishes the definitions of the key terms and concepts as used throughout the compact. Section 3 establishes the requirements for states to be eligible to participate in the compact. Section 4 describes the requirements for a dentist and dental hygienist to obtain a compact privilege to practice in remote states. Section 5 specifies that active duty military members and their spouses shall not be required to pay the commission fee for a compact privilege. Section 6 establishes a disciplinary framework between the compact participating states. Section 7 outlines the composition and powers of the compact commission. Section 8 establishes the commission's shared information system. Section 9 establishes the rulemaking authority of the commission to carry out the provisions of the compact. Section 10 ensures compliance with the compact by the member states and details the procedures to be followed in the event a participating state fails to comply with the compact. Section 11 establishes the effective date of the compact. It includes provisions for states withdrawing from the compact and the member states collectively amending the compact. Section 12 provides that the compact is to be liberally construed to effectuate its purposes, and compact's provisions are severable. Section 13 details that participating states retain sovereignty over all laws, and nothing must inhibit or prohibit the enforcement of laws that are not in conflict with the compact. And with that, Vice Chair, we are ready for questions.
Thank you for the presentation, Chair Marzola. Members, any questions? I will start with Assemblymember Hardy.
Thank you, Vice Chair, and thank you for another compact bill. It's great. So my question was first about the map and the colors of the state, but you kind of already answered that. There's 10 currently and then 16 are pending. And then as far as like the implementation timeline, it says 18 to 24 months. Is that of like April 2024 or like where are we on this timeline?
Chris Anderson for the record. Yes, you're exactly right, Assemblymember Hardy. That was from the beginning of that timeline. So we're well into that timeline at this point.
Thank you. Committee members, any other questions? Okay, I have one. I know you went through the numbers and you said there's about 200,000 licensed dentists in the state and only about 2,331 in Nevada and 1,500 hygienists. Do you know why our numbers are so low?
For the record, Karen Solie, S-O-L-I-E, and Karen is C-A-R-Y-N. I'm a dental hygienist, and I have been licensed in the state of Nevada as a dental hygienist since 1972. So I can historically say that the State Dental Board in the past held its own clinical examinations up until about 2010. And they only held them once a year for both dentistry and dental hygiene. So depending on when you graduated from your accredited dental or dental hygiene program and were moving or coming to Nevada to be licensed, they only gave that test once a year. And if they chose to give it in September and you graduated in May, you had a few months where you weren't working. So in the late 2010, they switched from doing their own licensing exam to utilizing a testing agency, which is called the Western Regional Testing Agency, which now has merged with several others, and that testing agency offers multiple tests in both dentistry and dental hygiene all year round, all across the country. So that does facilitate more convenience in taking that examination.
Okay, thank you. I appreciate that. Members, any other questions before we go to testimony? Okay, seeing none, thank you, presenters. Is there anyone in Carson City wishing to testify in support? Please make your way to the witness table.
While they're coming forward, may I go ahead? Again, for the record, Karen Solie. I'm representing the Nevada Dental Hygienists Association, and we have recognized that the workforce issues post-COVID era has created a great deal of workforce issues. We worked diligently and in collaboration with the Nevada Dental Association to bring forward this bill. We are very grateful to the Council on Government Service, or the Council on State Governments, the Dental Association, the American Dental Hygienists Association, and the Department of Defense. This will help tremendously to increase our licensure portability. Since 2001, our association has had policy endorsing and supporting portability of licensure. The remainder of my prepared statements has already been submitted, and I will let the benefits to the state of Nevada, the benefits to our state dental board, and to our practitioners stand for themselves. Thank you.
Thank you for your testimony. Next.
Good afternoon, Chair Howdy, and members of the committee. For the record, again, my name is Taylor Avery, and I'm the Manager of Political Affairs for the Vegas Chamber. The Chamber is in support of AB 143. Making it easier for licensed dentists and dental professionals to practice in our state means easier access to dental services for Nevadans. especially in our state's rural and urban communities where needs continue to grow. It is a long-standing position of our organization to support compact agreements that allow for individuals to practice in areas of critical need in healthcare. This bill will also allow our military spouses to stay in the workforce. Removing barriers of entry for qualified dental professionals is an essential step towards improving Nevada's healthcare system. We'd like to thank Chair Marzola for bringing the bill, and we thank the committee for their consideration.
Thank you for your testimony. Next.
Vice Chair and committee members, my name is, for the record, Andrew Lee Pilbit. I'm the chairman of the United Veterans Legislative Council in Nevada, representing 250,000 veterans. We support AB 143. Section 5 clearly notes, as the defense witness earlier said, it includes active members in the military and their spouses, a much needed compact that we should join. Thank you.
Thank you for your testimony. Next.
Thank you, Vice Chair, members of the committee. Isaac Hardy, representing Future Smiles. Just want to echo the comments and support. We are in full support of this bill. Thank you.
Thank you. Is there anyone else in Carson City wishing to testify in support? Okay, seeing none, I'm going to move to Las Vegas. Is there anyone in Las Vegas wishing to testify in support? Thank you. Let's fill the witness table, and the first person can begin when ready.
For the record, Antonio Ventura, Antonio Ventura. I am representing the Nevada Dental Hygienists Association. Full support of this. Just to highlight a couple things, I know nurse practitioners have gone through this process, the EMS compact, physical therapists, audiology, speech language, nurse license compact. I think this solution will really help bring qualified dentists and dental hygienists to our state, reducing long wait times. When I first got my dental hygiene license, it took me about 4 to 5 months after I've graduated for me to get my actual license. So I think this will reduce some of those barriers as well as enhancing public safety through that data sharing that they have. You know, if you misbehave in one state, they can share to the other state. I know that's a big concern as well. And then one of the biggest thing is that workforce development. I think this would be a really good common sense solution to bring dental hygienists that are already licensed, that have graduated from a program, to come to our state. Thank you.
Thank you for your testimony. Next.
My name is Gloria Silva, Gloria Silva, and I am in support of this bill. Thank you, Chair Marzola, for providing the accurate numbers for the amount of licensed dentists and hygienists in our state, because it was previously just completely stated inaccurately. So I appreciate that, and that is according to the licenses that have been issued by the Nevada Board of Dental Examiners. I'm also pretty disappointed to see that all the dentists have left now, which this is actually a more ethical solution for increasing the amount of providers that we have in the state. And also keeping in mind that we're going to maintain a standard of care, because the people that are going to come here will have the knowledge to actually perform the duties that they went to school for, and not just going to be trained on the job. It's also pretty surprising to me that the National American Dental Association is in favor of this bill. However, the Nevada Dental Association is not in favor of it. If their true concern was to increase the number of providers that are treating patients here, then they should certainly be aligned with this bill. It just, to me, shows a lack of concern for access to care for our patients. Again, I have been a hygienist since 2011. I graduated in May, but did not get my license until sometime in August. So it's just a lengthy process. This would certainly allow us to start practicing or be able to continue to practice without any type of delay, so that we can continue providing our services to patients. That is all. Thank you.
Thank you for your testimony. Is there anyone else in Las Vegas wishing to testify in support? Okay, seeing none. AVH, can we check the telephone line, please?
Testify in support for Assembly Bill 143. Please press star 9 to take your place in the queue. Chair, we have no callers choosing to testify in support at this time.
Thank you, AVH. We will now go to testimony in opposition. Is there anyone in Carson City wishing to testify in opposition? Seeing none, we will move to Las Vegas. Is there anyone in Las Vegas wishing to testify in opposition? Seeing no one approach the witness table, I will move to the phone lines. AVH, can you check the phone lines for anyone wishing to testify in opposition?
To testify in opposition to Assembly Bill 143, please press star 9 to take your place in the queue. Chair, we have no callers choosing to testify in opposition.
Thank you. I will now move to neutral. Is there anyone in Carson City wishing to testify in the neutral position? Seeing no one approaching the witness table, I will move to Las Vegas. Is there anyone wishing to testify in the neutral position? Seeing no one approach the witness table, can we please check the telephone lines, AVH?
To testify in neutral to Assembly Bill 143, please press star 9 to take your place in the queue. Chair, we have no callers choosing to testify in neutral.
Thank you so much, AVH. At this point, I will now close the hearing on Assembly Bill 143. Committee, we will stand in recess.
We will now come back to order. I will now open up for public comment. Please address your remarks to issues that fall within the jurisdiction of this committee. Public comment is limited to 2 minutes per person. Please remember to state and spell your name for the record. Is there anyone here in Carson City that wishes to give public comment? I don't see anyone. Is there anyone in Las Vegas that wishes to give public comment? Please remember to state and spell your name for the record.
For the record, Antonio Ventura, Antonio Ventura. I just wanted to say thank you for your time. I've been part of the legislative process for a couple years now, and it's always nerve-wracking, but it's getting a little bit easier, and I just want to thank you guys for your time and your work. I know it's a really time-consuming job. I also wanted to highlight kind of who stayed for what specific bill and kind of the intent behind each of those bills. Thank you.
Thank you for being with us today, and we are happy that you are part of the process. Is there anyone else in Las Vegas? Broadcast, is there anyone on the line?
If you would like to provide public comment, please press star 9 to take your place in the queue.
Gary Johnston, Las Vegas, BERRYJOHNSTON. When misguided politicians added fluoride to our drinking water, it sounded noble, but it's harming Nevada. Who wouldn't want to prevent cavities? But what if I told you that the whole program started not with dentists, but with fertilizer industry trying to offload toxic waste? That's right. Compound in most municipal water supplies isn't fluoride grade or pharmaceutical grade fluoride. It's fluorosilicic acid, a cheap contaminant byproduct from making phosphate fertilizer. And it gets worse. Las Vegas Valley Water District uses the cheap stuff because they don't care about giving us the best water. They care about checking a box to avoid federal fines. That's it. This isn't about public health. It's about regulatory compliance on a budget. A rusty barrel of fertilizer waste gets past the EPA mission accomplished. And yet we know now fluoride works topically on your teeth, not inside your organs. Drinking increases the risk of lowering IQ in children, thyroid dysfunction, bone fragility, arthritis, dental fluorosis. Yes, it damages your teeth. Calcification of the pineal gland, affecting your sleep and hormones. And despite all of this, they still pour it in our tap water. Why? Because you have not removed it from the NRS. Great business model for fertilizer companies. Terrible deal if your brain, bones, and babies are important to you. So let me ask you, do you drink sunscreen or do you put sunscreen on your skin? Exactly. Then why are we drinking fluoride? It doesn't protect us, it poisons us. Let's stop letting bureaucrats and industry lobbyists make health decisions for us. Take fluoride out of our water. Let dentists give a switch to those who need, but stop poisoning everyone, raising costs for our water. Thank you so much.
Thank you for your testimony. Broadcast, is there anyone on the line wishing to give public comment?
Chair, we have no more callers choosing to give public comment at this time.
Thank you. This will conclude our meeting for today. Our next meeting will be on Monday, March 24th at 1:30. This meeting's adjourned.